We are very happy to have you here online from LA, and it's a very unique connection, LA Rzeszów. Yes. I think it will be the first time this type of connection, talking about MSE and about your visit to Poland. And we are very excited, and we would like to ask you some questions about your next trip to Poland, because on the 8th and 9th of September you are going to give a 2-day course here in Rzeszów. And actually, as I said, we are happy to have you here, and we would like to ask you why MSE? I mean, why this technique is so important, and why should people come to the course?
Yes, well, first of all, thank you so much for organizing the meetings and also the interview today. And my next visit is going to be actually my third visit to Poland, largely because of you and your organization. So I really appreciate that. And every time I go to Poland, I learn something new. It's a wonderful experience for me. So I'm really looking forward to our next meeting. And your first question of why MSE, why am I so passionate about it? Why is this such an important topic in orthodontics? I think even without me saying so, everybody knows that there are a couple of really hot topics in orthodontics. One, of course, aligners, they're everywhere. But two, also expander. Expansion has been a hot topic for many, many years, almost a couple of decades now. Of course, we always knew about the expansion, but with the revolution of microimplant, whole orthodontic world has changed. I've been a clinical orthodontist for many, many years, and then I got into academics. But even when I was in clinical practice, MARPI really changed the way I diagnose and way I treat the patients, and it was a total game changer. And it wasn't the case from the beginning, because at the beginning we're just dabbling, experimenting. But as we investigated, we used more of this appliance. We start to learn about different impact, some positive, some negative. So we learn. So 20 years of my journey, I have a lot to share. So this is why this is such an important topic, because it's not one of those techniques that you just learn and say, okay, it's just another technique. This will completely really change how you see the cases and how you plan your cases. And, we used to have a glass ceiling. There's a limitation to orthodontics. We all know that. Yeah. But then the glass ceiling has been lifted. Now, to a certain extent. Where is the true ceiling now? We don't really know. We are still investigating. We're still learning. That's why I'm really excited to have a 2-day course, because, we had a 1-day course before. Yeah. Just simply enough for me to really explain everything that we learned over 2 decades of investigation.
Yeah, wonderful. Also, I know that MSA is very important, especially for the patients with OSAS also. So with problems with sleep apnea, and I do myself prefer expansion rather than extraction. And this is the way I've been thinking all my orthodontic career. So I understand that, and thank you for the answer. Can you tell us what are the main topics of these 2 days in Rzeszów?
So it's very nice arrangement, because the first day is going to be more of an introduction and overview of MSE. So we're going to talk about how it evolved and main fundamental ideas behind MSE, how to use it correctly, how to fabricate it correctly, how to apply it correctly. All these little things actually make huge difference. Because people always ask me, why are there so many different MARPIs out there? They all look the same. Yeah. But if you really look at it closely, they look similar, but they don't look the same. They all have different force vectors, and even with the same appliance, depending on where you place it, your results can be quite different. So it is quite important to really understand how it works. and how one MARPI works against the other type of MARPI. So that's what we kind of going to talk about, very fundamental basic principles with the support of all the research data. MSE is probably most investigated, most scrutinized MRP out there. My lab alone, we have 50 publications. So just imagine publications out there. I don't think there's any appliance, extension appliance out there. It has been that much scrutinized. So we learned that. That's what we're going to cover first day. Second day is quite interesting. We're going to kind of go deeper, much deeper, into more usage, stuff that we learned in recent years. Because initially, it was better than previous expander, so we used it. The limitation of orthodontics has expanded, so we kept doing more and more. And along the way, we learned many, many new things, such as sleep apnea situations. And I was not a sleep apnea doctor from the beginning, and still not. Yeah, but just because patients, the testimonial, and many people who used my appliance came and told me the wonderful results they were getting. But I'm the scientist, so we did some research in that area, and we had a very nice result that I can share with everyone, so that we can kind of be very objective about what MSE could do to the airway, not necessarily me telling you we can cure sleep apnea, which I don't think is the case. But we're going to see many, many interesting cases and how we can help our patients. So that's one of the area. But most importantly, troubleshooting. We all get into problems, any appliances, there's not going to be 100% success. And initially we were trying it on relatively younger, easier patient pool. Now we're becoming very brave because of the success we had over the years. Now we're trying on very difficult cases, patients with a very advanced stage, patients in 40s, 50s, 60s. Wow. And we're dealing with the patients with the extreme skeletal disharmony. We're dealing with the patients with the craniofacial problems. So when you do something like that, there's going to be the learning curve is quite stiff. And I probably made more mistake than anybody in this world because I've done thousands of these, and that's what I want to share. What works, what doesn't, and when it doesn't work, my team try to investigate why it didn't work, how we can improve it. So these troubleshooting is quite important, and we're really gonna get involved in that. And then we're gonna also talk about some of the side effects that we can expect, and then some of the side effects we should be avoiding.
Yes.
So this is more of an advanced level, and also it is quite different. When you're beginning, you may not care about all these other things I'll be talking about during the second day because you just want to learn how to use it right.
Yes.
But if you haven't used it a few times, you'll experience, okay, it works most of the time. How come it doesn't work here? You have this little itch.
Yeah.
That's where I'm going to go and scratch. Because that becomes quite important. So second day, we're going to focus more on troubleshooting, some of the new discoveries, some of the future projects we have utilizing this new technique. So such as a modification of AP relationship, for example, class 3 patients. We know that we can do growth modification in children. Can we do it in adults?
Wow, wonderful.
Right? So something like that will be quite advanced usage, and that's I did some of this talk during my first one-day course in the past. But I really want to spend time and really delve into it together with my audience.
Wonderful. So I'm very happy to hear that, and so you are going to have some tips and tricks in this second day.
Yes. lots of different trips and lots of also failed cases, because we learn more from failed cases than successful cases.
Yes. I think the same. During after you arrive to Rzeszów, we will of course show you our city, and we will take you around the city, and we will have a small party after the first day. So maybe we are going to dance, or who knows. After the second day, we are planning to take you to Zakopane, Zakopane is a city in the Tatra Mountains, near to Slovakia, and I hope you will enjoy the journey. And then you are flying back from Krakow, but you are going to Sofia, I think, yeah? No, you're not going back to LA, no?
No, because I have to go to Bulgaria for Bulgarian Society of Orthodontics. They have an annual meeting.
Yeah,
So I'm giving a one-day course there right afterwards.
wonderful. So, we really enjoyed the talk, and we are very excited about the course, and waiting for you in Rzeszów, and we would like to show you the city, to show you our hospitality here in Poland, and looking forward to see you soon, dear Professor.
Fantastic. I really, really looking forward to it. And I know it's really hot globally, so please stay cool
Yeah,
until I get there.
Yeah, we will ask him. So we are going to make it, I think. Okay,
Yes.
Thank you so much. Thank you for this talk and for the explanation of the course, and hope to see you soon, dear Professor.
Bye-bye.
Thank you. Thank you.
Thank you.